Our next topic is on safe food, and many of you have heard about food safety. We've been talking about that for most of this year. In fact, it was our World Health Day topic, and we've carried it on in other campaigns as well. It's an issue for everyone. Has a disproportionate impact on vulnerable groups, especially children, pregnant women, and the elderly. It requires action and good policies across the entire food chain, from production to consumption. Most of us think of food poisoning as a bout of nausea and diarrhea, but globally, more than 350,000 people die from contaminated food annually. In the Americas, about 1 in 4 suffers from an episode of food poisoning in any given year. This does not have to happen. And we, again, as part of the World Health Day message, which is do your part to ensure food that's safe from farm to plate. Here to join us this morning and talk about that is our very own Enrique Perez, and he is the Senior Advisor for Foodborne Diseases and Zoonosis here at PAHO.
Yes.
We've talked about this many times in the past. It's great to have you back and talk about this again.
Thank you so much for inviting me.
Sure. So Enrique, in terms of food safety, which it needs to be ensured throughout the food chain,
right.
From farm to plate, who's involved, what needs to be done?
Yes. Thank you. It's a very nice question indeed. Do you remember during the World Health Day that we have this promotion in terms of the do your part? And
Sure.
What means do your part? Means that producers, processors, distributors, retailers, consumers, everybody, all the stakeholders along the food chain has a responsibility in food safety. And this is exactly what food safe or safe food from farm to plate means, is everybody has to do their own part.
So what is PAHO doing to promote food safety?
Yes, well, PAHO has a regional program in food safety, which works with member states in 4 big programs, I would say. One is the legal basis, the legal framework. It's good that the countries should have a very nice type of legal framework because this is the basis of everything. The next big pillar is about surveillance and diagnosis. So the countries needs to have the capacity in detection and in response for foodborne diseases. The next one is inspection services, so it's how to avoid the contaminants in food, and works with the countries in terms of improving the inspections, the way that they improve how the food could be safe.
Sure.
And last but not least, social education and communication. This is basic. Everybody should know what is their part and what to do.
So there's another important food safety issue related to one of the resolutions to be improved by the Directing Council.
Yes.
Can you talk more about this?
Oh, yes, indeed. Yes, indeed. Tomorrow we will have in this house a resolution going about antimicrobial resistance. And one of the components is the use of antimicrobials in food-producing animals. This is a big challenge. I don't know if you know, Derek, but almost in some countries, almost 80% of the antimicrobials that are being used are used in healthy animals. And this causes, of course, selective pressures in the bacteria, resistance, and those bacteria goes through the food to the humans. So working with the farms, working with the producers, working with the veterinarians, it's in terms of the prudent use of antimicrobials is very important, and this resolution of tomorrow will take care of that.
Enrique, I know that it's clear from our work together on this that you're very, very passionate about this topic. And of course, we're going to be moving on to a new campaign for next year for World Health Day. But what can we do to kind of keep this top of mind in people's head, looking towards the following year? We obviously don't want to have this just be a one-year commitment to food safety, to be thinking about that. We need to kind of keep the message and the campaign going in some way. What can you do and what can we do to be thinking about that?
Yes, I would say that the continuous work that we do from PAHO with the member states are very important. Always creating the awareness, always talking with the countries in terms that they have to look for safe foods and relate the safe food with the nutritious food. You know, we eat every day. We eat every day. So we are exposed to chemicals, to chemicals contaminants, to microbiological contaminants every day. So the point is, if we can build up this awareness in the persons and we can transmit that every day, will be the way to go. Also the kids
Yeah.
they promote change.
Sure,
They promote change of habits in the
So is there
persons.
something maybe you can just share with us real quickly? Is there something that you do personally in your life every day that could be, that we can relate to, that would be in terms
Yeah.
of how you practice food safety?
Actually, is to practice the 5 keys for safer food. That
wanna tell
means
us what those are again?
the first one is hygiene. Wash your hands. Do it correctly before you eat. Before you handle the food, you have to wash your hands. You have to have the surfaces that where you do the cooking should be clean and should be out of contaminants.
Sure.
The next one is cook thoroughly. We have to cook thoroughly our food. The next one is to keep the temperature safe. That means if you have something that should be in the refrigerator, should be there to avoid the growth of the bacteria, right? And this is something that I practice every day at home. And last but not least, avoid cross-contamination. That means if you use a cardboard, for example, to cut some meat,
Right.
never,
Yeah, use it for something.
right, never put later on some food that you will eat raw.
Sure. Very, very good tips, and always good to remember those kinds of things. Enrique, thank you so much for joining us this morning.
Thank you, Derek, for having me here.
Look forward
It's
to
a pleasure.
continue talking about this topic.
Yes, sure indeed. We will.
Important.